Endovascular abdominal aortic aneurysm repair? Endovascular abdominal aortic aneurysm repair, EVAR, is a minimally invasive procedure used to treat abdominal aortic aneurysms, AAAs, which are localized dilations of the abdominal aorta that pose a risk of rupture. EVAR is an alternative to open surgical repair, offering reduced perioperative morbidity and mortality rates, especially in high-risk patients. Procedure overview. 1. Preoperative imaging. Detailed imaging using CT angiography or MRI is performed to evaluate the size, location, and anatomy of the aneurysm. 2. Access and deployment. Small incisions are made in the femoral arteries to access the vasculature. A guide wire and catheter are used to position a fabric-covered metal stent graft within the aorta. 3. Stent graft placement. The stent graft is deployed to reinforce the weakened section of the aortic wall and exclude the aneurysm from blood flow. 4. Sealing and fixation. The graft seals against the aortic walls above and below the aneurysm, redirecting blood flow through the stent graft and reducing pressure on the aneurysmal sac. 5. Postoperative imaging. Intraoperative fluoroscopy and follow-up imaging confirm graft placement and exclude endoleaks. Long-term outcomes of EVA. Advantages. 1. Reduced perioperative morbidity and mortality. Lower rates of blood loss, shorter hospital stays, and faster recovery compared to open surgery. Particularly beneficial for elderly or comorbid patients. 2. Durability. High success rates in excluding aneurysms, with reduced rupture risk if properly maintained. 3. Improved quality of life. Quicker return to normal activities. Challenges and complications. 1. Endoleaks. Persistent blood flow into the aneurysm sac, classified as Type 1, leak at graft ends. Type 2, retrograde flow from branch vessels. Type 3, graft defects or separations. Type 4, porosity-related leaks. Type V, endotension, continued sac expansion without detectable leak. 2. Aneurysm sac enlargement, caused by incomplete exclusion or progressive degeneration. 3. Stent graft migration, leading to loss of proper positioning and aneurysm protection. 4. Device failure. Late complications include kinking, fractures, or fabric wear. 5. Reinterventions. Some patients may require secondary procedures to address complications. Long-term surveillance. Regular imaging, typically using CT or duplex ultrasound, is essential for detecting complications, particularly in the first 5 years after EVAR. Compliance with follow-up protocols significantly impacts outcomes. Recent advances in EVAR. 1. Improved stent graft designs. Fenestrated and branched grafts allow treatment of aneurysms involving complex anatomy or branch vessels like the renal and mesenteric arteries. Low-profile devices facilitate access in patients with small or calcified vessels. Polymer sealing technologies enhance sealing and reduce endoleak risk. 2. Advanced imaging and navigation. Use of intraoperative 3D imaging, augmented reality, and fusion imaging for precise graft placement. Development of mobile imaging solutions for outpatient procedures. 3. Customized grafts. Tailored stent grafts based on patient-specific anatomy, especially for cases with irregular aortic neck morphology. 4. Endoanchors. Mechanical fixation devices used to secure grafts and reduce migration risks in challenging anatomies. 5. Drug-eluting grafts. Coating stent grafts with medications, e.g. anti-proliferative agents, to prevent graft-related complications like intimal hyperplasia. 6. Minimally invasive techniques. Techniques such as percutaneous EVAR, EVAR eliminate the need for surgical cutdowns, reducing recovery time and complications. 7. Use of artificial intelligence, AI. AI-driven algorithms assist in preoperative planning, outcome prediction, and personalized treatment strategies. 8. Endovascular aneurysm sealing, EVAS, an emerging technology using polymer-filled endobags to completely seal the aneurysmal sac and reduce complications. Future directions. 1. Biodegradable stents. Ongoing research focuses on stents that gradually degrade once the aneurysm is stabilized. 2. Better long-term surveillance tools, non-invasive monitoring systems for real-time graft status. 3. Genetic and biomarker studies, investigating the molecular basis of a AAA to improve risk stratification and preventive strategies. 4. Telemedicine and remote follow-up, leveraging wearable devices and remote imaging to enhance post-EVAR care. EVAR has revolutionized the management of AAAs, offering a safer alternative to traditional surgery. With continuous advancements in technology and techniques, its safety, efficacy, and accessibility are expected to improve further.